This is TTT Live. I'm DK Ronstar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, the Chief Medical Officer, Dr. Roshan Parasram, and Dr. Mariam Richards, the Principal Medical Officer, Institutions at the Ministry of Health. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you, Minister Cox. Good morning to the Chief Medical Officer, and good morning to Dr. Mariam Richards, who is one of the stalwarts of the parallel healthcare system. Good morning to ladies and gentlemen of the media and to the citizens and who are listening either in Trinidad and Tobago, wherever you are, or anywhere in the world. Today is Wednesday, 22nd July. And with each passing day, the world seems to hit new milestones in fighting this coronavirus pandemic. And into the 6th month, it is still a pandemic that is growing day by day. The average number of new cases per day continues to be over 200,000 worldwide. Continues to be over 200,000. Just a month ago, it was between 100 and 200, then it went up to 150 to 200, then 200 plus. And it has been over 200 plus now for about two weeks or so. This is a very disturbing development, and that contributes to the global caseload of 15,154,448. So we have breached another milestone, the 15 million milestone. The number of deaths, unfortunately, 621,172. Ladies and gentlemen, members of the media, the biggest threat to our safety as a global community now, with each new phase of this pandemic, is solidarity. Because of lockdown measures implemented across the world in different levels at different timetables between February and March, we understand that people are now yearning to go back to life as they knew it pre the pandemic. Until we have a vaccine that has been properly trialed, that has proven to be safe, effective, we cannot go back to our pre-pandemic days as we know it. What is threatening the world now, in addition to the virus, is the breakdown in political and societal solidarity, which has helped certain countries who have done better than ours. That word solidarity is going to be very important. Because in Trinidad and Tobago, yes, we had some solidarity in the very early days, but we need to have that solidarity now even more. It is this solidarity and that purpose in vision and mission that has helped us escape the worst. Of the 621,172 deaths globally, we have only had 8. Which is a pretty good place to be, except if you are one of those 8 families. And our condolences, again, go out to them. But think about if we did not have that political and societal solidarity. Instead of talking about 8 deaths, we could have been talking about 80. That is something that we ought not to be contemplating. The reason for talking about solidarity this morning is that because we at the ministry have reached a very disturbing place where we now feel that we have to come to you, the public, and explain to you some of the problems we are having. In the past, we would come here and talk about the fight against coronavirus, and we will hardly ever talk about the problems we face in mounting this good response. But at the ministry, we have reached a point now with our returning nationals that if we don't have that solidarity, it becomes a threat to the healthcare system. It becomes a threat to where we are. It will become a threat to the economy because we don't want to go back into a lockdown phase. We have never complained before. We have dealt with all the issues behind the scenes. But I think today at the ministry we have reached a sort of a breaking point. What is the issue? Minister Young will tell you about all the requests for people to return to Trinidad and Tobago, and how when they make their requests, they promise to adhere to quarantine guidelines. Sadly now, in many cases, what we are being faced with those that we have brought back are demands being placed on us that simply cannot be met. We now have returning nationals who, when they are clamoring to come back, say they will sign this, they will do this, they will go there. Not all, but some, and it's again the few that will threaten the entire system, are now refusing to sign the quarantine forms. This is a dangerous precedent. The Chief Medical Officer will explain to you the importance of that quarantine form. And they are now refusing to sign the quarantine form once they land in Trinidad and Tobago. When we allocate them to sites, they are now refusing to go to the allocated sites, and they are demanding to go to sites of their own choice. That is not a condition on bringing you back. We have to go to sites that have been assigned by the Chief Medical Officer, that are fit and proper to be used by quarantine, for quarantine purposes, where we have access to you by healthcare workers that are under the control of our protective services, so we have access to the sites. Many people now are simply refusing to, one, sign the quarantine forms, and they are demanding that they go to a site of their choice. A difficult situation in managing this is being made even more difficult. And we are urging all returning nationals to understand that these demands simply cannot be met. Why? Because it is because of solidarity, which we spoke about earlier, that has led Trinidad and Tobago to be in the place of choice for the world. And as Minister Young constantly says, we are committed to bringing back our nationals in a smooth, strategic, careful manner that will not break our healthcare systems. We have reached the point at the Ministry of Health, and we will have these talks with the Ministry of National Security, where we may even have to ask people before they board a flight to come home to sign your quarantine forms, but this ought not to be. Solidarity, and let me repeat, it is solidarity that got us here. It is singular purpose of mission and vision that has got us here. In many countries around the world and many blocks of countries, you would have seen recently the EU had to have one of their longest meetings in history to come up with a rescue package for the EU countries. Tough negotiations, but in the end, they got solidarity. You are seen in many other countries where there's political wrangling. And when you do these things, the only thing that wins is the virus. The virus does not care about all of these things that we are wrangling over. So, in the context of where we are in the world, in the context of the role at the Ministry of Health in setting policy, we have put forward a policy position on quarantine, which is second to none anywhere. But it can only work smoothly if those nationals who were literally begging and screaming to come back here, once you land here, please cooperate with us by signing your quarantine forms and by going to the centers which have been used before to high acclaim by many people who have gone into these centers. They have been used to high acclaim, very high acclaim. These centers have been outfitted at taxpayers' expense for your comfort. You have healthcare workers who are charged with the responsibility of looking after you in a world-class manner. All we ask from our returning nationals is to cooperate with us and to make this process as smooth as possible. So that's my plea this morning. So Minister Cox, I want to thank you for this opportunity, and I now hand back to you.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Okay,
Dr.
thank
Parasram.
you, Minister Cox. Morning, Honorable Ministers, Dr. Richards, members of the media, members of the viewing and listening public. The clinical update for Wednesday, 22nd of July is as follows. So the total numbers done thus far, 6,186. The number of unique patient tests are now at 4,655. Total number of repeated tests stand at 1,531. Total number of community tests in the public sector, 2,247. In the private sector, 1,534 as of last week Friday. Total number of positive cases now stand at 140. Number of discharges are 127, and the total number of deaths remain at 8. Now, over the last 2 days, within yesterday and this morning, we would have had 3 additional positives. 2 positives came from, as you would have saw in the press release yesterday evening, one from returning nationals from Canada and the other one from Saudi Arabia. So there were 2 imported cases. However, there's one case that we picked up at one of our health centers, which we got yesterday afternoon. It is pending investigation, so the investigation has begun yesterday. There's no overt or open link to air travel, recent air travel. So it is being investigated, and of course, as soon as we culminate that investigation culminates, we'll have a better idea of what the source of that infection is. In terms of the total number of persons that are hospitalized, we now have 4 individuals at the Cora facility. There's 1 person en route from the Chancellor Hotel at this time. So that will take it up to 5 on our 6 p.m. update. With regards to the quarantine facilities, there are 155 persons at various facilities at this time, and they are spread between 5 facilities. So we have the UE Debe campus, which has 24, the Chancellor Hotel with 20 individuals. At the Cascadia Hotel, we have 43. At the Tacarigua facility, there are 20 individuals, and at the Home of Football, we have 44 individuals. As it relates to regulations that are still in place, we just want to take the opportunity to remind everyone, and for clarity, there's no regulation as it relates to sporting activities. However, as we have said before, the medical advice remains, and more so with this last case that we have gotten, with no link to importation, there remains a concern for children, and we are asking parents to do all that is necessary to protect your children at this time and take personal responsibility for their well-being. So we're asking that all child-related activities be held until September, aside from the SCA and other examinations that are taking place. Minister Cox, that's my clinical update for this morning.
Thank you very much, Dr. Parasram. Dr. Mariam Richards, the Principal Medical Officer Institutions at the Ministry of Health, will provide an update on the parallel health facilities used by the national COVID-19 response.
Good morning. Thank you very much, Minister Cox. Good morning to the Honorable Minister of Communications, Minister Cox, Minister Diyal Singh, CMO Dr. Parasram, members of the media and members of the viewing population of Trinidad and Tobago. This morning, I would like to provide an update on the facilities in the parallel healthcare system, as well as bring some information and insight into the selection of quarantine facilities, the types of quarantine facilities that are in place, the limitations and demands that are placed upon the Ministry of Health with respect to the quarantine facilities. As you are aware, the Ministry of Health launched the parallel healthcare system on March 12, 2020, when we operationalized an isolation ward at the Cora Hospital to accommodate the first positive case of COVID. Since then, this parallel healthcare system has evolved into one which involves approximately 922 beds across 4 levels of care. The division of these beds is based on WHO international standards regarding the mortality and the morbidity of COVID-19. Today, I would like to speak about the benefits of the parallel healthcare system and also feature a discussion on the quarantine sites and quarantine facilities, given the influx of returning nationals that have been granted exemptions by the Ministry of National Security. The major benefit of the parallel healthcare system is that it allows the traditional healthcare system, that is the system that we would have been accustomed to prior to the COVID-19 pandemic, to operate as normal. I am sure that each of us has relatives and friends or even personal experiences of seeking medical care for chronic diseases such as diabetes, hypertension, or emergency services. For example, if someone has a laceration or a cut or viral illnesses, and that they have been able to go to the Eric Williams Medical Sciences Complex or the Port of Spain General Hospital to seek care. The major benefit of the parallel healthcare system is that it allows the traditional healthcare system to continue unabated and provide a seamless service to members of the population. Another significant benefit is that the parallel healthcare system prevents or reduces the risk of infectivity to healthcare workers managing persons with COVID-19, as well as persons who are accessing the traditional healthcare system. A third benefit is that the parallel healthcare system allows for a specialized and standardized level of treatment, given that COVID-19 really involves the care of persons who require intensive care treatment, pulmonology, chest medicine, and internal medicine treatment. Today, I'd like to speak about the selection of quarantine centers and the type of quarantine centers that are available. At present, the Ministry of Health has several quarantine centers that are either state-run or state-supervised. In order to efficiently select new facilities, or as the WHO terms them, alternative medical care sites, the Ministry of Health has developed a robust framework as a platform for the selection of these sites. We look at several perspectives that are examined by a multidisciplinary team of technical experts to identify suitable quarantine sites. For any quarantine site, we look at it from a public health perspective, an infection control perspective. We look at the engineering aspects, disaster preparedness, occupational safety and health, health safety and environment, security, financial and economic costs, socio-political and environmental dimensions. And for each of these perspectives, we have technical experts with significant experience in the field to assist in making a determination of a suitable site. We have consulted and used guidelines from the World Health Organization, the Pan American Health Organization, the NFPA guidelines, as well as the FGI guidelines for the design of alternative medical care sites, because we believe that it is our responsibility to ensure the safety and the protection of our population. There are 2 types of quarantine sites currently in use by the Ministry of Health. There are state quarantine sites and state-supervised quarantine sites. And I'll go into the distinction between these 2 sites. State quarantine sites are as follows: the Home of Football in Couva, the UE Debe St. Augustine campus in Debe, the Brooklyn Center in Sandy Grande, the Tacarigua Center at the National Racquet Center in Tacarigua, and the Balandra Center in Balandra. These sites are fully run and operationalized by the Ministry of Health, and persons are selected to go into sites depending on a risk assessment that is carried out by the Ministry of Health in collaboration with the Ministry of National Security. State-supervised quarantine sites consist of hotels that were selected through a robust procurement exercise supervised by the Ministry of Health, and that currently we are looking at hotels such as the Cascadia Hotel, the Chancellor Hotel, and as of yesterday, the Regent Star Hotel. These hotels provide accommodation for returning nationals with costs to be borne by themselves or their company or organization. They also provide food and other services. However, security and medical coverage and assessment is carried out by the Ministry of Health. As you're aware, the exemption process starts with the Ministry of National Security, and the Minister of National Security has the authority to approve an exemption. Once that exemption is approved, the Ministry of National Security collaborates with the Ministry of Health to identify a suitable quarantine site in advance of the returning national or person's arrival in Trinidad and Tobago. The selection of the quarantine site for the individual is based on a thorough risk assessment that is carried out. At our state quarantine sites, we have some sites that allow for single occupancy rooms with ensuite bathrooms and so on, and we have some sites that are more dormitory style. So I'll give you an example. If we have a group of employees or students who were living together in the same dormitory and co-mingling for a particular length of time prior to arriving in Trinidad and Tobago, and who are coming from a low-risk environment, that is a country that has low rates of COVID-19 spread, and that there are young, well population with reduced comorbidities, these persons may be assigned to a state quarantine site which may have dormitory-style facilities. Now, I would like to reiterate that persons really, we try to accommodate persons in their own rooms, but they may have to share bathrooms and some other facilities. On the other hand, if persons come from a high-risk environment, that is, they come from a country where there are high rates of COVID-19 in the population, as well as they come from disparate groups, we try to assign them to quarantine sites where we reduce the level of commingling, that is, into single occupancy rooms with their own bathrooms and own facilities. It is important for us to also note that even though a state quarantine site may have, for example, 70 beds or 70 rooms available, we cannot fill all rooms at one time. The reason being is that there may be some sort of plant and equipment or engineering issues that may arise. So, for example, if there is a problem, a plumbing problem in a bathroom or so, we would have to relocate the returning national. With that in mind, when we accommodate persons at state quarantine facilities, we do not fill the facilities to the maximum, but we have an overflow, or we have an allowance of, let's say, 5% of rooms that we keep in the event of any sort of adverse situation that may affect the accommodation of the individual. Another factor that we have to take into consideration when we are assigning quarantine facilities is if there is a positive case that comes up at a particular quarantine facility. If there is a positive case, we sometimes have to reset the quarantine time at that facility, which will delay the use of the facility. And also, once all persons are discharged or leave the facility, the sanitization process takes much longer. All of these measures are essential for for us to protect the population's health and to ensure the safety of your loved one when they return home to you and your family. Another limiting factor is that we have to look at the maintenance and downtime between cohorts of persons or groups of persons that are coming into the country. With any facility, there are maintenance issues that need to be addressed. For example, plumbing, tiling works, roof repairs, and so on. While we have persons within a facility, it is not feasible to have these sorts of repairs being done unless there is an emergency. We are, of course, considering the inconvenience that may be borne by persons at the facility, as well as the risk of transmission if we had to bring on servicemen and contractors to do repairs with persons in the facility. Accordingly, at times, once a facility is deemed vacant and all persons have been negative, the appropriate sanitization process is carried out. We sometimes need a period of 1 week or 2 weeks to conduct an assessment and thorough repairs to ensure that when the facility is reused, all persons are comfortable and all of the standards that I discussed earlier have been met. I would like to speak about the state-supervised facilities and the hotels. The hoteliers were asked to submit expressions of interest to indicate if they were willing to provide quarantine facilities. The management of these hotels is guided by Ministry of Health guidelines with respect to the conduct and logistics of activities at these hotels. These items are monitored strictly by the Ministry of Health. The Ministry of National Security provides security through the Trinidad and Tobago Defense Force at all of the state and state-supervised facilities. The Ministry of Health conducts medical assessments, which includes Day 2 and Day 12 testing by reverse transcriptase polymerase chain reaction testing, the international gold standard testing for COVID-19 at all facilities. This activity is carried out by the relevant county medical officer of health for the particular facilities. Now, we've been asked about hotels and increasing the number of rooms available. And it's material to note that even if we were to operationalize and to open all hotel rooms that have been made available to the Ministry of Health, there are other limiting factors that would compromise the level of care being given to our returning nationals. This would ultimately compromise the safety of our population. So, for example, if we try to open additional quarantine spaces, there is need for additional persons from the Trinidad and Tobago Defense Force to provide security and the required logistics, for example, transfers for that facility. Furthermore, we are using the same pool of physicians that have been employed with the Ministry of Health to carry out testing, monitoring and evaluation, daily surveillance of returning nationals at the hotels, transfers, follow-ups, admissions, and discharges. If we try to expand exponentially, we will have challenges in maintaining the quality of medical care and public health measures, as well as security challenges in ensuring that these facilities are well run. We appreciate and understand that returning nationals and their families are very anxious to return to their homes, but the Ministry of Health and the Government of Trinidad and Tobago looks at the safety of the population, and our quarantine process is very robust to reduce the commingling of persons who may be high risk. Even prior to entering the quarantine facilities, the logistics involved in transferring returning nationals as they arrive in the Piarco International Airport are very robust and require a large degree of attention to detail to reduce the commingling of persons of unknown risk. As you are aware, we have had several imported cases of COVID-19, and it is through our robust quarantine system and the adherence of employees at the state-supervised quarantine facilities, as well as the healthcare workers at our state quarantine facilities, and the adherence of persons who are in these facilities as returning nationals, that we have been able to contain the spread of COVID-19 and to protect our population. In closing, I would like to thank members of the population and all returning nationals for their continued collaboration, patience, and assistance as we attempt to continue to secure the health of the population at large. Thank you very much, Minister Cox.
Thank you very much for such a comprehensive information shared with us today. Actually, before I go to the members of the media, there is something that I want to ask the CMO, because I have been bombarded with a number of persons have been asking about Pennywise, and I'd like the CMO to tell us, what is happening.
Okay. All right. So it is related to the case that we would have had, not the 140, case 139. So basically, as we have discussed, the way this epidemic has progressed from the start, there are what we call simple cases and there are complex cases in terms of public health tracking and epidemiology. So there's a simple case that someone will have a viral illness, will have COVID-19, and stay at home, live by themselves, and basically don't move when they have signs and symptoms, which is a simple sort of public health tracking event. And it limits the amount of spread that occurs. So in this particular instance, what has happened is that the person would have been ill for more than a week, having signs and symptoms, and would not have restricted themselves to movement within their homes, would have functioned as normal. So moved about the community, gone to different places. In the household itself, there would have been upwards of 8 persons visiting or live or residing in that particular household. So those persons who visit or live in that household become primary contacts of the case. So from that, anyone that was in contact with the primary contacts now becomes secondary contacts. And as we have showed time and time again, the triad of infection goes in a triangle, starting with the case, and then going to primary contacts, secondary contacts, tertiary contacts. Now, the person has been ill for about a week and has moved about, as I said. One of the primary contacts would have interacted in some way with Pennywise. We noted two closures of 2 outlets on the Charlotte Street, as well as the Long Circular Mall branch, which we closed this morning, asked them to close. The closure is for sanitization. We will do line listing of the staff, as well as we will do testing as necessary of primary, secondary, tertiary cases. There would be closure later today of the FCB El Socorro branch as well. And as it goes in terms of the investigation, there will be further closures that may have to take place for sanitization, for line listing, and for continued tracking. Remembering that this is the first case we have had of this nature for over 80 days, and we want to ensure that this case, there's no further spread and that we are able to identify exactly where this case comes from, which will take a few days of investigation as well as testing before we can make a definitive statement as to whether we think it has come because of contact with someone that may have traveled or possibly contact with a healthcare worker, but we need to do the investigation and complete it before we can say with definitively what is the source of this particular case, whether it is the primary or is it linked to another case that we may find along the way. Mr. Cox?
Thank you. Thank you very much, Dr. Parasram. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to post questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. Guardian Media Limited, Rishard.
Hi, good morning, everyone. Rishard Khan, Guardian Media.
Good morning.
My question is for the Chief Medical Officer and, well, I guess the Minister of Health, if he could weigh in as well. Now, with this case 139, I know you said investigations are still underway and you all are trying to see where the source came from. But now that we've had mingling going on, and like you said, the person has been moving around, how real are the concerns now that we could be seeing community transmission taking place? And if that is the case, any advice or further advice for the public? Should the public be worried?
CMO?
So yes, it is a concerning development, generally speaking. As I said, we have been over 80 days without any sort of case of this nature. The last one we would have had similar to this was 116, where we had a person mingling in that regard. So, as we have said from day one, the public health measures are still relevant and extremely important. Wearing your mask and all the other public health measures become and remain extremely relevant as the main measure that the population can do in preventing the spread. But we will continue to track and have persons in self-quarantine, home quarantine, until we can test everyone to try to ring-fence this particular incident so that it doesn't spread and go beyond this case or any additional cases in the population.
And Rishard, if I may add, we have been pleading with the public from day one. If you are ill, stay home. No, the public health measures are so simple. Wear a mask, keep a distance from people, stay home if you are ill, wash your hands, sanitizer, cough into the crook of your elbow, avoid touching your face, and clean and sanitize surfaces. These are all very simple, inexpensive measures. And I'm not blaming anybody, but if that one person had heeded the advice to stay home when they were ill, then Pennywise wouldn't have to shut down today. FCB wouldn't have to shut down. It is such a simple measure. If you are ill, stay home, seek medical attention. If you have a fever, you're coughing, both the CMO and I, if you go back to earlier press conferences, we kept saying, pretend that you have the virus and pretend that everybody around you has the virus. And if you do that, these simple masks over your mouth and nose is an excellent barrier. But if we ignore these simple, inexpensive public health measures, look at what has happened today. 3 institutions have to shut down. We now have to do contact tracing. I'm not complaining because that's what we do. But think about how all this could have been avoided if that individual had just stayed home when they were ill and sought medical advice. So I am hoping that with this case, everything we have been talking about as public health measures will be heeded by the public. And I want to thank you, Rishard, for raising the issue.
Just to clarify, we just got word from FCB before you ask your second question that the person did not actually enter the branch, so there may be no reason to close. It would have been an automated transaction on the exterior, so they may not close their branch more than likely.
So just to fill it in, I would have spoken directly to the CEO, Ms. Karen Dabisi, this morning about that possibility. We gave her the name, and that is why they were able to track what sort of transaction the person did. So that is how robust how robustly the system is in dealing with this thing. So hopefully that facility will not have to close. So that's some good news there.
Thank you. TTT?
Oh, Rishard.
Good morning. Crystal Wilson, TTT Limited. I'm not too sure who will answer my question, but it comes on the heels of the announcement that persons have refused, or there are persons refusing to sign the quarantine forms. I'm not sure that you all can share with us how many people have refused to, but if you can perhaps share with us how these situations have been handled and how concerned should the national population be?
Yeah, sure. So the CMO and Dr. Richards.
So basically, I have learned of 2 incidences myself, 2 persons coming in, I believe, yesterday. So the county medical officer, who is designated authority, quarantine authority, given that authority from my office. So I am the quarantine officer for Trinidad and Tobago. The CMOHs are delegated authority from the Quarantine Act to perform that function at the county level. So I would have been in contact with the CMOH with responsibility for that particular quarantine facility, indicating that 2 individuals were refusing to sign the form. The defense force is on site and had asked for the forms to be signed. Everyone else complied. In instances like that, we can write a quarantine order directly to the CMOH office, naming the individuals and stating that they are under quarantine, which can be signed under my hand to ensure that there's compliance. So rather than the person signing, I can send an order saying that these two individuals are to be quarantined because of the risk that they pose. And as you know, the COVID-19 has been added to the quarantine schedule by the President of the Republic in the last day of January, I believe, 2020.
I could tell you for myself, Crystal, since we started bringing in individuals, I have had over 50 requests come directly to me by people who are known to me, acting as, I'm going to use the word agents, on behalf of people who are quarantined because they know me. And I have resisted every single of those 50 to intervene in a process. Because as Minister of Health, the day I start to intervene in that process, I become a danger to society. So I have never given in or caved in to any one of those approximate 50 requests sent to me by people who know me acting on behalf of those persons coming in. It's a very difficult situation to manage, but we are firm in our belief that the protocols we have put in place are robust to protect the health of the country. And I give this country my word. As Minister of Health, I have not and will not intervene on anyone's behalf to choose which side they go to.
AZP News.
Hi, good morning. Priya Bihari, AZPnews.com.
Morning,
I just want to find out the case 139. Can you say where this person was tested and how old this person was? And seeing that the person went to the ATM machine, does that maybe give more risk to the public? And how would we deal with that? Thank you.
Well, as you know, Priya, based on patient confidentiality, we can't give out that sort of information in terms of ages, etc. To the population. In terms of the risk, as you asked about the ATM machine, the company has said that the machine would be sanitized. However, if you have visited a branch of any bank recently, the protocols are in place for a reason. And the protocols really are, of course, wear your mask when you go in, wash your hands. Most of them have hand washing facilities outside. Either wash or hand sanitize your hands. So we are hoping that the person would have adhered to those guidelines, wash their hands, wore a mask before going into the ATM, which would give you that assurance that the actual machine itself is free of viral particles, and then it would have been sanitized after. And if someone goes in after, washes their hands, use their mask, and continue that sanitization process, the virus wouldn't be able to be transmitted to another individual. But the guidelines are there for a reason, and the sanitization of the machines should be done extremely frequently, maybe every hour or so, to ensure that persons are protected.
On another note, for anyone who thinks they have a viral illness, a fever, we reiterate, we have hotlines set up for you. Let me call out the hotline numbers again, and they are well known. In Trinidad, we have 800-WELL, 800-9355. We have 877-WELL or 877-9355. And in Tobago, we have 800-HEAL or 800-4325. So if anyone comes down with a fever, the signs and symptoms of COVID, even the lesser known signs of loss of sensation of taste and smell, these are some signs that people ignore: fever, coughing, headache. Make use of these numbers, but most importantly, stay home and don't circulate until you have a test, and then you can be guided accordingly.
91.9.
Hello, good morning, ministers. Good morning, doctors.
Good morning.
Morning.
91.9 FM. just two quick questions, and probably to the doctors. How confident do we feel that the 14-day quarantine period is sufficient for people who are returning from various areas, considering that we are having this repatriation happening now? Are we comfortable that the 14 days is sufficient, or can we see someone going through the quarantine period and then emerging later on with symptoms and possibly passing it on? And the other question is, can we speculate that persons can now sneak out or leave quarantine, interact with other people and places, and probably leave pathogens around that other people will be able to interact with and possibly collect the virus, and thereby give us a situation where we have community spread? Is that a possibility based on the quarantine facilities that we have in place? Those are my two. Good morning.
So your first question, as we have said this is a brand new virus, right? It's only about 6 months old in terms of the amount of research that we could have done related to it and related to the incubation period. From all accounts, the most people will present signs and symptoms between that 14-day period, and we have seen that happen in Trinidad as well. We have seen people as late as day 13 being picked up with positive. There are outliers in every scenario, and we have seen that occur where there's research evidence that suggests that people can present as late as 42 days plus in terms of incubation. The WHO still recommends the use of the 14-day incubation period, and Trinidad still uses the 14-day incubation period, bearing in mind that most of your cases, 95% I assume, will fall within that 14-day period. As an added addition, once you're discharged from a quarantine facility, we do follow you up from the CMOH office for an additional 7 days to take us to 21 days to ensure that there's no signs and symptoms developing beyond. So we have in-house state quarantine for 14 days with 2 rounds of testing, and then we have another 7 days, which is supervised follow-up at home, so it gives us a total of 21 days. So we do cater for a little outlier in that event. With regards to your second question, you just want to run it through quickly for me?
About security, them leaving the
Right, so in terms of the security, as Dr. Richards has indicated, our state supervised as well as state facilities are secured by the Defense Force of Trinidad and Tobago. So they are very secure sites. We look at the security structurally as well before deciding on a suitable site. So we look at the fencing that exists so that it will make it easier for the Defense Force, and they are part and parcel of the site visits to ensure that they can secure a site in the way that they wish to do so. But they are all secured by the Defense Force.
Okay, thank you. I believe TV6 is next.
Hello, Rynessa Cutting, TV6 News.
Good morning, Rynessa.
Good morning.
Morning. Now that we have this development, can the ministry state whether a rollback of the phased reopening is being actively considered at this time? And hello?
Yeah.
Yes.
Go ahead.
And also, given that this case number 139 would have visited a number of commercial establishments, what is the advice to members of the public who may have also visited these very popular places?
Okay, so I will take the first question and part of the second question. The short answer is no, not at this time. We are not considering rolling back. Let us see what presents itself. We said at the very start of the first phase of the reopening, it's a matter of risk. How much risk are you willing to take? You can't shut down a country and shut down an economy for the long term. At some point in time, you have to start to reopen. And we and the Prime Minister led this charge, and we came up with a very careful reopening plan. You would remember the amount of pressure we had from different groups to reopen earlier. And we did reopen earlier because the results were good. So at this point in time, on Wednesday, the 22nd of July, there is no active consideration about rolling back anything. What we are doing is being very careful, and that is why we have traced to certain business establishments, and those business establishments are being advised to close and do the necessary sanitization. So that is where we are with that. CMO can handle the others.
Yeah, so I think in terms of we will wait until the investigation bears out, and then we can make further determinations later on as it relates.
However, again, Rynessa, it comes back to this. And I can't overemphasize it, the simple public health measures. Every member of the public should assume when they go into a store that everybody there has COVID. You're walking along in Carlton Center in San Fernando, the mall in Tobago. If everybody assumes that everybody around you has COVID and you wear a mask, you know, we could open up more and more of the economy. Because what I'm seeing is that people are becoming more and more complacent, and I pay attention. The percentage of people I see with masks with each passing week is dropping. A mask is a simple, cost-effective measure, not only to protect your health, but to protect the whole economy. Everyone has to do their part, and that's why I use the word solidarity before. We need solidarity in this thing, in the wearing of masks, cleaning of hands. It's as simple as that.
Minister, it is being said that many ATMs does not have hand sanitizers or nor sinks. Is there anything that can be done?
Well, we can have a chat with the Bankers Association. I want to thank you for raising that, and that is something that we will raise with the Bankers Association.
Okay, thank you. Guardian Media Limited.
Good morning, all. Kevon Felmine Guardian Media.
Morning, Kevon.
Good morning.
Okay. So CMO, you speculated that case 139 could have, they could have had contact with someone who recently traveled. Is there concern that that people are stepping through the borders as we see Venezuelan immigrants still coming into the country, and also tropical depression 7 has evolved into tropical storm Gonzales and is heading towards TNT. Can this affect any of the ministry's COVID-19 care and measures, especially if it warrants a need to increase bed spaces at the various health facilities?
Okay, so I will attempt to take two. The first part of your question is really a question for the Minister of National Security, but it is a concern for any country that has a migrant population. The second part of your question, the Ministry of Health at the start of every hurricane season, as a matter of course, does a total revision of its disaster preparedness plan. This year, it was heightened because of COVID, and Ms. Patty Ann Williams, who has been here a couple times before, she is responsible for that response. Eastern RHA, which normally bears the brunt of any bad weather, and Tobago, TIMA is an excellent disaster response agency. They are also on the ball. So we are prepared. This happens every year, but this year, because of COVID, we will be paying special attention to all our step-down facilities and quarantine facilities. Thank you for the question, Kevon. Very timely.
As the CMO has any
No.
addition? No? Okay. Express?
Hello.
Hello.
Good morning.
Kim.
Oh, good morning,
morning.
ministers, doctor. Okay, so my first question would be, I guess, primarily for the CMO. CMO, we've had only 8 deaths, and I would like to ask this in a sensitive way. But really what we want to ask is, how come we have not had more deaths? It is being considered a deadly, if not always fatal disease. Can we get an idea of...
Kim, hold on. You can't say that. This is not an always fatal disease. We have to be careful, Kim.
No. I think the audio is bad, Minister. I said not an always fatal.
Oh, sorry. Phew.
Okay, Kim,
No.
we are running out of time, so give us your two questions quickly.
Yeah, so I think what we want to ask is, how come the morbidity has not been higher, and can we get an idea of the age group of the people who have been tested positive so far? Because we have been under the impression that many of them, or a lot of them, would also have had NCDs, other chronic illnesses. Also, Minister and the CMO, are you all satisfied so far with the SCA measures? Sorry, with how SCA placement is going, how the students are being physically distanced? Are the children understanding what they have to do? Also, the teaching staff, everyone involved.
Okay. So in terms of the deaths, I mean, we continue to monitor the cases that we have, and we give them the highest level of care that we can give to them. We have been learning, our clinicians have been learning from the experiences of other countries in terms of the clinical management of the cases. And luckily, we have had so far only 8 deaths, which occurred early on in the epidemic. I don't want to say exactly why. The demography in terms of what we had, we would have had older persons to the most part being part of our small group. We have a very small group of persons that would have been positive compared to other countries. 140 is a small number to draw any major conclusions from the death rate as it relates. But worldwide, the death rate has been different from one country to the next, somewhere between 2 and 5% in some instances. So I don't think, because of our sample size being so small, I don't want to draw any particular conclusions about the mortality rate based on that small sample size. It may not be statistically significant enough to draw any major conclusions. We'll look at the deaths in the other parts of the world, and we're looking at their percentages as well. But we are doing all that we can. We are learning clinically. We're putting the necessary equipment and staffing in place to ensure the smallest chance of death. And I believe having a policy that even if you are mild or asymptomatic in place, that we go to a hospital. In some countries, what happens if you get a positive case and they're mild or asymptomatic at the start, they are not put in a hospital. They're left at home until their symptoms get worse. What we do is we put you, as soon as we get a positive, whether you have no symptoms, you are mild, straight into a secondary or tertiary care facility. And this is to monitor, because what we have noted is that for this particular disease, there are people that are well now, and in 4 hours they need ventilation. So we don't want to take that chance, and we get people into our facilities as quickly as we can, monitor them for the full stay. So if someone decompensates, they're already in a place that they can have HDU care, they can have ICU care, and we can give them the best clinical outcome that they can get.
And Kim, let me just add, for statistical purposes, what I have been advised by the actuaries and so on, it is difficult to make conclusions from a small death cohort of 8. We normally consider 25 deaths, unfortunately, to be at least the minimum where you could start to make any kind of inferences or conclusions. So we're not even close to that. So that is why the CMO says, it's difficult to make conclusions from just a small amount of 8, which is a good thing for us.
And in terms of your second question related to SEA, we continue to work with the Ministry of Education. As you know, we have submitted our guideline formally to them last week. They would incorporate that into their program. They have asked for our assistance by way of sending public health inspectors to do inspections to ensure that things are in place and to give technical advice, which we will continue to do throughout the process. And of course, as matters arise, we will be working very closely with them to ensure that the guidelines are adhered to.
Newsday.
Hi, good morning, everyone.
Morning.
Morning, Olive Gonzales from Newsday. I just have 2 questions for the CMO. My first question, the Commissioner of Police said at a press conference on Monday that he attempted to sit and discuss with you guidelines surrounding youth sports and the restart of that also. I would like to know, were you able to meet with the Commissioner since then? And if yes, what was the consensus of that meeting? And in my second question, it's concerning the information the 3 nationals who returned from Grenada that tested positive last Friday, July 17th, and then recently tested negative. I would like to know which testing site was used, and is there a possibility there may have been an error in the first test? That's my 2 questions. Thank you.
So with regards to the Commissioner, I have received emails over the weekend, and I had spoken to Ms. Lisa Ghani, who is, I believe, their PR representative for the Trinidad and Tobago Police Service, as it relates to my stance on that particular incident. However, the Commissioner had suggested via Ms. Ghani a list of persons to meet, and I had asked Dr. Richards, who is here today, to arrange a meeting with all those persons from TTPS. I believe she's set it for tomorrow. So that will happen hopefully tomorrow, and then we can have a discussion as to the way forward with that particular incident.
Sorry, but let me just reiterate what the CMO said earlier and what we said in earlier press conferences. We said team sports can go on. You could play your cricket, you could play your football, you could play your volleyball, but just no crowds, no big audiences. So it's not that adult sports can't be played. They can be played, but no big crowds, right? But you will have a crowd on the side, your trainers, your masseurs, your ball boys, and so on. Keep it to 25. Make sure they have on masks. Okay?
And in terms of the question from Grenada, so I was in contact with the CMO from Grenada as well throughout, and I know Minister was in contact with Minister Steele from Grenada. So basically what we had is we had repatriation of our persons coming in. We had 3 separate nationals from 3 separate areas of Grenada testing positive at the same time using, you asked which center we use. We use the Caribbean Public Health Agency for PCR testing, which is the gold standard. That is actually the site that Grenada also sends their tests to be done. So that is the regional center for testing. As I said, in terms of, there was always the question in the air about false positives. With PCR testing, it is very difficult to get a false positive. Once you have a sample of viral material in that sample, it will be amplified. So it is, as I would say, easier to get a false negative. And especially so that we had three different individuals testing positive at the same time. And this is the site we have been using, not only Trinidad, but the rest of the region from the beginning. It's a well-validated site. We would have had Dr. Indar from CAFA on air saying that their sensitivity is extremely high, over 99%. And they actually pick up the viral load and are able to tell us whether it is high, medium, or low. What I am being told in these particular cases that the viral level was extremely low. So they picked up a very low viral load, which indicates a very old disease. Hence the reason they would have no symptoms, and they would have had no symptoms for quite a while. And when we retested, as our protocol dictates later on, we expected that we would get a negative, and we did get our 2 negatives, and those persons could have been discharged. So it seems like an old illness that was on the tail end with very low viral loads. And again, CAFA is the reference lab, and the results have been very good throughout the epidemic.
Thank you very much, Doctor. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As we go, we wanted to address the entertainment industry, one of the most affected by COVID-19. We know it must be difficult for you at this time, but do understand that the government has to be responsible. One of your industry's unique selling points is close contact and interaction among persons, which is being discouraged at this time. The 3 additional persons who tested positive for COVID-19 in Trinidad and Tobago between yesterday and this morning is a reminder that we are still living with a pandemic. We understand that you too are facing challenges at this time, but we are asking you to hold strain a little while longer as we try to protect all of our citizens, including you and your industry. Please know that the government is aware of your plight, but we must choose life over livelihoods. Until our public health officials advise us differently, we would like to guide you to the assistance offered by the government to all artists and creatives. You can apply to the Ministry of Community Development, Culture and the Arts for financial assistance. And this grant is for artists and creatives who lost income as a result of COVID-19. And is meant to provide a measure of relief to those affected by cancelled exhibitions, classes, conferences, workshops, and other cultural events between the period March and December 2020. But even if this does not apply to you, the Ministry of Community Development, Culture and the Arts also announced that should you want to use one of the national performance spaces under its remit, you would not have to pay the full rental cost. You would only pay half the price until December 2020. You have the option to use the National Academy for the Performing Arts, the Southern Academy for the Performing Arts, Queen's Hall, and Naparima Bowl, of course, while observing the public health guidelines in place for use of these spaces. For more information, you can contact communications_CDCA at gov.tt or contact the Ministry's Grants Secretariat at 225-2322, extensions 5230 or 5226. We do understand that it has been a tough time for you, but the pandemic and the restrictions put in place to suppress it are having or taking a heavy toll on everyone. We must come out of this alive. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. Save lives. May God bless Trinidad and Tobago.
This is TTT. Live for